So as Heart Month is winding down, there's a new service that Carle is actually gearing up. It's called Cardio and it features cool technology to help give people with heart failure control over their condition. Today's community sponsor is the Carle Heart and Vascular Institute, and Dr. Uday Kanakadande is here with a little bit more information. Welcome.
Hello.
So happy National Heart Month. We're in the home stretch.
Right. Yeah.
But this is kind of your big month, right?
Yes,
so
absolutely.
We're bringing awareness to heart failure. So let's kind of talk a little bit about what that is and what it means.
So heart failure is a condition where the heart is not able to pump enough blood to meet the metabolic needs of the body, meaning to provide enough nutrition and oxygen for the body's needs.
And so we're looking at some of those things that you just mentioned.
Right.
Stiffened tissue. How does your tissue get stiffened?
Right, so it actually refers to the heart muscle getting stiffer, and we're seeing that that's a more common form of heart failure. So as a pump, the heart has two fundamental functions. It has to dilate or relax to receive blood from different parts of the body, and then it has to pump or squeeze enough blood to, to provide oxygen to the body.
Okay.
So when either of those functions fails, that's when people get heart failure.
And maybe shortness of breath is one of those symptoms that they're experiencing.
Yes.
So what causes it?
Yeah, so once the heart starts failing, the body tries to compensate. And the body does this by retaining more salt and water. In the initial stages, it might help, but eventually these counter-regulatory mechanisms become hurtful. So there's fluid buildup in the lungs and in different tissues, and that leads to many downstream metabolic effects.
Which aren't good.
Right.
Right? So you've got this new procedure at Carle. So tell me a little bit about it and how it works.
Right. So we have a new procedure called cardio MEMS. MEMS is actually an acronym for micro electromechanical system. So it's a tiny little micro transmitter. It is implanted into the artery of the lung called the pulmonary artery.
So is that like an enlarged version of the transmitter that we were looking at?
That is correct.
Okay.
And in this video, we can see how it is implanted. So we first introduce a catheter into the vein of the leg. Through that, we identify a good pulmonary artery where this device can be implanted. And then we release the device inside the pulmonary artery where it stays permanently. The little wire wings they're made of nitinol, and they help to anchor the device in place. And then this shows you how the patient transmits the data. It records pulmonary pressures, and it is sent wirelessly to a central monitoring unit. We have a dedicated team of heart failure specialists who then look at the data, and then they can adjust the medicines.
Wow. Okay, so you've actually brought an example of the device that is implanted, and it looks just like a piece of hair. It's so thin and minuscule.
This is the device.
Like you can, it's very hard to see right there.
Yeah. So the actual device itself is this that I'm holding in my hand, and the little wire wings help to anchor it in place.
And is there any risk of that shifting or moving?
Well, once it anchors in place, it doesn't move much. What happens is the body's lining then starts to cover the device, and it becomes a permanent implant.
So I know my grandpa had like a defibrillator with his heart that needed, the batteries needed to be replaced.
Right.
There's nothing like that with this kind of device.
Yeah, no, the device is still new, so I don't know how long it lasts yet, but the manufacturer tells me it's going to keep transmitting forever.
And this is the device here on the table that they lay on that transmits all of their data.
Yeah, so this, pillow-like thing is actually the antenna. It is the antenna unit that the patient goes home with. It has to be plugged in. And there's a little button in the back. Once you press it, it gives you voice commands. And the patient just has to lie down on it, usually for about 18 seconds at a time, sometimes a little longer, but always less than a minute. And then it wirelessly transmits the pulmonary artery pressures to the central receiving unit.
Yeah, feeling it, it does feel just like a little cushion, like that you're just laying on a little pad.
Yeah, it's not very comfortable, but under a minute a day.
You can suck it up, right? Speaking of going back to how we implant the device, minimally invasive.
That is correct.
How long will it take?
So generally the procedure takes about half an hour.
So that's not bad.
Right.
And then they can go home that same day?
Yeah, so sometimes we send them home same day, sometimes we might observe them overnight.
Okay, so let's talk patient benefits that we're seeing here on the screen.
Yeah.
Immediate benefit? Like they'll feel better immediately, or?
Well, so this is a monitoring unit. So it helps us monitor the pressures, and then it helps us tailor the treatment. So it turns out, you know, one of the first changes that happens when someone goes into a worsening or exacerbation of heart failure, the pressures inside the pulmonary arteries start to rise. And we can, with this device, we can detect that before the patient starts feeling any symptoms. And generally, you know, what happens is once the patient gets these symptoms, we have to give them extra medication, or we have to bring them to the hospital and give them IV medicines, which in turn have other side effects. And, you know, putting someone in the hospital is expensive.
Right.
With this device, we can monitor patients and we can detect problems before the patient gets symptoms.
So this isn't like a fix. This is like a helper for the doctor to know how to proceed and treat.
So it does help to reduce the frequency of hospitalizations. It helps to reduce the frequency of complications.
And they go home with one of these, and they lay on it at home, and then it transmits back to you. That's cool. Okay, so if people want to learn more about, you know, preventing heart failure, heart disease, what do they need to do? Obviously, prevention.
Yeah, so prevention is, you know, it's a major focus. Heart failure is a huge public health problem in the United States. You know, so in this video, we're seeing the actual device implantation procedure. The catheter is now, it was introduced in the pulmonary artery, and it's showing the device next to a dime so that we can compare it for size. So when, you know, coming back to preventing heart failure, if you're over the age of 40, there's a 20% lifetime risk of developing heart failure. So, you know, you need to talk to your primary care provider if you have any risk factors. And then the other things you can do, regular aerobic exercise and watching your diet, and, you know, preventing some of the preventable causes of heart disease, such as hypertension, diabetes, obesity. It plays a big role.
All right. And so if they want to learn if maybe this is a good fit for them, that's when they connect with you all.
Right, yeah, or
Carle.
talk to your doctor, and, you know, we're always here to help.
Thank you so much. Interesting stuff. And this is fairly new, right?
It is fairly new, yeah.
Okay, and if you need any more information about this new cool technology, head to SayLiving.tv.